A very nice introduction there. Really appreciate you working together with us to help with this educational event, which I think should really add value to the listeners today. So, and for our webinar participants, I think many of you might be suffering from frequent accidents resulting in pad usage, uncontrollable urgency to go to the bathroom, or getting up multiple times at night. If this sounds like you, well, again, good news. There are many options to give you some relief. And as Landon mentioned, my name, again, is Dr. Garrett Pohlman. I'm a board certified urologist here at Kearney Urology Center, PC. Our clinic here is based in Kearney, Nebraska, but also we offer outreach clinics in many of the surrounding communities. Some of the outreach clinics that I serve include clinics in Holdridge, Nebraska, Broken Bow, and Ord. I joined Kearney Urology Center just over 7 years ago. I was born and raised in Norfolk, Nebraska. And on a daily basis, I'm helping men and women in successfully finding solutions to their incontinence issues, and would like to help educate you tonight on the condition of overactive bladder as well as solutions available. So here is a common theme we see all too often. I was so tired of rearranging my schedule around the bathroom. It was always on my mind, but I was just too embarrassed to talk to my doctor. Many of you might be feeling like the patient quoted here: concerned, exhausted, overwhelmed, but too embarrassed to talk about it. Embarrassment is a real issue of concern for as many as 44% of people who have bladder control problems. Too often, it prevents people from getting the help they need. Well, we are here to change that. Participating in this webinar today is definitely a step in the right direction, so thank you for your courage, and I hope you will continue to speak up about this important issue. Here's what we'll be talking about this evening: understanding bladder control. This will really be an overview of how the bladder works and some of the problems that can occur, the care pathway, which shows the possible progression of treatment options, where I'll be offering more detail about the many ways to treat bladder control issues, Medtronic bladder control therapy, which covers 2 proven and effective options, and then we'll wrap up by answering your questions. First off, what you really need to know is that you're not alone. Overactive bladder, also known as OAB, is extremely common. For example, it's more prevalent than vision problems and diabetes, 2 conditions most of us think of as being extremely common. You may be asking, if it's so common, why haven't I heard about it until now? Well, many people with OAB self-manage by drinking less, wearing pads, and restricting social activities. At the same time, many physicians don't realize how embarrassing it is to talk about bladder control issues. So many of our primary care providers don't ask, and you may never bring it up, so it stays hidden. Like vision problems, bladder control issues can happen to women and men of any age. And although your risk increases as you get older, that doesn't make it a normal part of aging. It's not something you should just accept or ignore or leave untreated, because that can raise serious risks for your self-esteem, confidence, and general health. It's really important to note that incontinence or urine leakage is not a normal part of aging or something you should just have to live with. It's a serious health issue. I'm sure these descriptions will sound very familiar to many of you. Going more than 8 times per day, getting the very urgent need to go to the bathroom, planning your activities around the bathroom, monitoring how much you drink, and using pads to control the leaks. Bottom line, OAB can be a very embarrassing condition, and it can have a significant impact on your quality of life. It may prevent you from going places or doing things that you like, fearful of an accident, always looking for that next restroom, making frequent trips to the restroom throughout the daytime. If that's the case, you need to listen to your body. To understand what your body is saying, it's important to know that communication is critical to how the bladder works. Bladder function involves the coordination of the brain and muscles through nerve signals. As your bladder fills with urine, nerves tell your brain that it needs to be emptied. Research suggests that bladder control problems are linked to poor bladder-brain communication. Keep these points in mind for later. when we talk about how various treatments differ from one another. So, where do these communication problems come from? There are many potential causes. Some are as simple as what we eat and drink every day or the medicine we take. Some are related to life events like childbirth and health conditions. You may also have injured your pelvic floor. In general, there are three common bladder control problems. Let's take a closer look at each of them in turn. Number one, stress incontinence. Two, urinary retention. And three, overactive bladder. So, what is stress incontinence? Well, stress incontinence relates more to familiar physical activities. It occurs when there is an increased pressure on the bladder as a result of a cough or sneeze, or with activities such as lifting, resulting in a sudden loss of urine. Stress incontinence is typically due to weakened or damaged pelvic floor muscles. This type of incontinence often requires surgical correction. Urinary retention. This happens when you are unable to fully empty your bladder. This can be incredibly frustrating and may also require you to use a catheter. It may or may not be caused by a physical obstruction, such as the prostate in men. So you may have obstructive or sometimes non-obstructive retention. And lastly, overactive bladder, or again, OAB. OAB is defined by the following symptoms. Urge incontinence is the sudden urge to go to the bathroom, which also results in actual loss of urine because you can't make it to the bathroom on time. Frequency means frequent trips to the bathroom, as well as the constant urge to urinate that often leads to leaks. If you have OAB, you may have a variety of overlapping symptoms. It's our job to work through these symptoms to help you find a therapy that fits your needs. Well, right now we are going to focus on overactive bladder. The good news is that OAB is a treatable condition. So there are a number of steps involved in finding the best treatment for you. Conservative treatments, as shown on the left, advanced therapies, which are on the right, and we'll take a look at each one. Remember that every person is unique and works for someone else. And what works for someone else may not necessarily work for you. So the first thing is to try often simple lifestyle changes. In other words, these are behaviors that you can use to help your situation. It might mean changing what you eat or drink, such as decreasing your coffee or soda intake. It might involve bladder retraining, such as delaying going to the bathroom or sticking to a schedule. There are pelvic floor strengthening exercises, also known as Kegel exercises. Now, these are things that you probably already are doing or have already tried without success. Now, when lifestyle changes fail to deliver the results you want, oral medications are the next step. These medications work on the bladder muscles, not the nerves. They can help control symptoms, but they do have some drawbacks. You have to remember to take them every day. The side effects can be unpleasant, such as constipation and dry mouth, and they don't always work, which may be why in one survey, 72% of people said they stopped taking the medication after 6 months. One last point. For some patients, OAB medication causes some confusion and memory loss. In fact, a recent large study funded by the NIH and the National Institute of Aging and published in the Journal of the American Medical Association has shown that elderly people taking anticholinergics, which are medications to treat OAB, are at a greater risk for developing dementia. If conservative treatments don't work for you, there are advanced therapies. Medtronic offers 2 of those therapies, and the third is an injected medication. Now let's go over some of the trade-offs involved with each of these options. Injected medications, known as bladder Botox therapy, treat OAB temporarily and require multiple ongoing treatments. With this, medicine is injected directly into the bladder muscle to paralyze it. If you use injections, you may be more susceptible to urinary tract infections and end up having to catheterize yourself, at least until the effect of the medication wears off. which may be why some individuals up to 51% quit after just 2 treatments. Another option is PTNM, or percutaneous tibial neuromodulation. It can help restore bladder function, meaning it can reduce your urgency, frequency, and urinary incontinence, which can lead to improvements in your quality of life. Here's how the therapy works. It stimulates the tibial nerve, which is located just above your ankle. The goal is to restore bladder function, achieving a measurable reduction in your OAB symptoms. Each treatment session lasts 30 minutes and takes place in one of our offices. You start with 12 weekly sessions and then move on to monthly maintenance sessions. So it can be a bit more time intensive than the next option I will get to here in a bit, called interstim therapy. The interstim system is also referred to as sacral neuromodulation. This therapy provides relief and it restores your bladder function by gently stimulating the sacral nerves. Medtronic bladder control therapy delivered by the interstim system uses gentle nerve stimulation to correct the bladder-brain communication pathway and restore bladder function. And it really is the most popular option for relief of overactive bladder here at Kearney Urology Center, PC. Now, what is handy about this therapy is that you are able to do a test run with the therapy first to see if you are a good candidate for this treatment. Unlike some bladder control treatments, our therapy lets you try it first. It's kind of like a test run, not a long-term commitment. Now, at the end of the test, you'll have a much better idea if this therapy is going to deliver the relief you expect. The interstim system offers proven results as well. This is important data, especially in comparison to oral and injected medications. Now, 84% were satisfied with the results. It offers 3 times greater improvement in quality of life compared to medication. Also, when looking at treatment success, medication came in at an underwhelming 49% success rate. In fact, interstim therapy is the only therapy that provides better relief than medication. So what makes someone a good candidate for this therapy? If you have significant symptoms of OAB, like urge incontinence and urgency and frequency, or if you have the non-obstructive variety of urinary retention, or if you have already tried many different kinds of lifestyle changes and oral medications. And most important, you are not getting the kind of relief that you want or need to get back to living life the way you want. If this sounds like your experience, the first step is typically an evaluation. So what happens next? Well, next step would be to contact our office at Kearney Urology Center at 308-237-7719 to help schedule a follow-up appointment so you and I can talk one-on-one. Again, thank you for your time this evening, and next we'll get on if there are any questions.
Thanks, Dr. Pohlman. For all the participants there, like we said earlier, if you have any questions, please go ahead and type it into the Q&A or the chat feature of the Zoom. Thank you so much. Dr. Pohlman, I have a couple of questions that are commonly asked, and I'll just kind of run a few of those past you. These are questions that come up often as we're working with patients, and I'm sure are prevalent in your office. And some of these are specific to the interstim therapy, the interstim treatment. One question we get a lot, is how long will this relief last, or how long does the system last?
Well, that's a very good question, and as far as the relief and the symptoms, generally, once someone, we go through the process of seeing if a patient is a good candidate through this with the test, or the what we call peripheral nerve evaluation. And that's the great thing about the test is it's a test. It's, to really kind of try out this treatment and see if you're a good candidate for it. And if you have a 50% improvement in your symptoms during the test phase, which typically lasts about a week, then you're a candidate to, then bring you back to do the put the system in place. And that's, I think one of what makes it so popular in our clinic is that it is a long-lasting therapy, and typically the system itself is dependent upon how long the battery life lasts in the system, which is anywhere from 4 to 5 years is what we found. And so, and we can closely monitor that, especially once we get, towards that fourth or fifth year. And then simply all we need to do at that point is go ahead and replace the battery. So.
Perfect. Thanks. Another question that did come in is, will insurance cover the cost? And also, another question is, what does that stimulation feel like?
So typically, and that's one thing that, InterStim has been around for quite some time, and it is a proven therapy. And so that's why, Medicare and private insurances are very willing to cover this, because it does work. But that's something that our clinic will work with you to make sure before we proceed with the test, to make sure that there's not going to be any issues with the insurance coverage. And as far as kind of what that stimulation feels like, most patients report that initially when they start feeling the stimulation, when we put the system in place, is it's almost like a little flutter. And I have a lot of patients that tell me that it just kind of ultimately becomes background noise, where they barely even notice that it's even there, but they know it's working because their symptoms have improved. So.
Perfect. Thanks. Two last questions here that I have. One just says, is there any limitations afterwards? And then another kind of follow-up question is, am I able to have an MRI with this in?
Yeah, that's another great question. And, as far as limitations after the procedure, typically, it's a minor procedure. We do perform this at the surgery center, but it's what we call an outpatient procedure. So you come and go same day. As far as during the test phase, we do have some restrictions as far as for 1 week, just trying to limit the extreme activity and kind of limits bending over and so forth. But once we put the device in place, I usually tell patients just kind of take it easy for a week. But I mean, it's not major surgery, and long term, there's no major activity restrictions after the procedure is done. What was the second question?
Also related to that, was the question of, can I have an MRI or other imaging afterwards?
Gotcha. Yeah. As far as MRI, this was a limitation with the system until recently, which it is now a MRI compatible, for that system. And so that's definitely been a game changer for affected individuals wanting this treatment that still need to get regular or routine MRIs or need an MRI down the road. So.
Perfect. There was two more questions that came in as you're answering that one. The first one says, I would like more info on the stress incontinence, specifically with sneezing or coughing. Are there exercises to help this or other treatments?
Yeah, as far as the stress incontinence, again, we talked about the different types of incontinence, the stress incontinence or the urge incontinence. And a lot of individuals have what we call mixed incontinence or some of both. So for the treatment options for the stress incontinence, typically there's really no medication that is used for stress incontinence, or again, the leakage with coughing or sneeze. The conservative treatment would be starting with Kegel exercises, which is an exercise that helps keep the urine in when you cough or sneeze. Oftentimes we work closely with the physical therapist that can actually work with the individual on training how to do these exercises and to make sure that you're doing them appropriately. And they can also counsel you on how frequently you need to be doing these exercises. But those exercises can work for the more mild cases, but as for the more severe or moderate cases of incontinence, it's typically surgical therapy. And really, the two main options are more of a collagen injection therapy, or what we call macroplastique. Uh, the success rate isn't quite as high as what we call a sling procedure. And so, really, the most popular, most commonly uh, performed procedure is what we call a TVT, or tension-free vaginal tape procedure, or a sling procedure, to kind of help support that urethra. So that way it's not under tension, but it's there when you need it. When you cough or sneeze, it kind of helps hold that urine in place. And it has a very high success rate too. And it's a durable procedure with a success rate anywhere from 90 to 95%, meaning no pads.
Awesome. Thank you. Another question that came in, are there any reasons you could not use the InterStim system?
Again, and as far, I'll let you kind of chime in here too if you want, Landon. But I think the biggest one, as far as not being able to use it in the past, has always been, if somebody really needed an MRI. But for us, we really haven't had any major restrictions that would prevent somebody from getting getting the InterStim system. And that's kind of the nice thing about, whereas with medications, which often, are typically not always effective, and there's side effects, there's really no major limitations to doing the therapy, which I think has been great to have this.
Yeah, I'll chime in just a little bit. According to our labeling, InterStim is off limits for anybody that needs regular diathermy, which is not a very common treatment, but what it is, diathermy is a deep heat physical therapy based treatment. And so if for any reason somebody needs that on a regular basis, we would recommend a different treatment option. And then Dr. Pohlman mentioned the test. The other person that's not appropriate for long-term therapy is just somebody that doesn't respond to the test. And so obviously during the week-long trial, you're able to evaluate that for yourself and kind of make decisions based on the results you got during the test as well. But that's really all that is mentioned in our labeling, in addition to what you already said.
Yeah, and with that being said, with the diathermy, for somebody needing frequent diathermy or cauterization, near that device, I really haven't in my practice come across a patient that needs frequent diathermy treatments. And so, but that could be the case for somebody. But again, I haven't run across that in my practice so far, fortunately.
Okay, it looks like that is the end of the questions, at least that have been sent in. We give you another one more chance here to send anything in if you do have something. Otherwise, like Dr. Pohlman mentioned, please feel free to follow up with him at the office. On the slide that is up now, there's two different websites, I guess, where you can go to get more information on overactive bladder. And I'll put a specific plug in for Dr. Pohlman's Carnegie Urology Center PC website. They've done a very nice job of getting very valuable content and content that is very applicable for patients on there. So I would encourage you to track them down on there. And Dr. Pohlman, I know that you're also on Facebook and some other social media platforms. Is that correct?
That is correct. Carnegie Urology Center has a Facebook page, and we have a YouTube page as well. And that's another thing to bring up for the attendees, is that this will be viewable at a later date once we get the recording all finished. And I think there may even be an email going out for the participants where to access that. But definitely we'll make sure that we're getting it up on our YouTube page, and we'll probably even put a link on our Facebook too. So make sure to follow us on Facebook. That way you can make sure to get all of the updates as they come your way. And definitely give us a call to schedule an appointment to further discuss some of these options at 308-237-7719.
Perfect. Well, thanks again, Dr. Pohlman, for your time. Thanks to all those that logged on and joined us for your time this afternoon. And like I said, please direct any further questions to Carnegie Urology and Dr. Pohlman.
All right. Thanks again, everyone.